Hello, friends, and welcome to our AIS Facebook platform again for another aspect to discuss. Today, I'm going to talk about Ayurvedic Holistic Daima certified course, what this is, and who requires that course, and why it is so important. Now, in Ayurvedic uh, medicine, when we are studying Ayurveda and to become an Ayurvedic doctor, as I shared in the past, this study is for 6 year full-time university study, and then you have to do 1 year internship. And as we discuss in our diploma level qualification, when we are teaching in Australia at AIS and or the advanced diploma qualification, we still talk about all the 8 branches and essential components of Ayurvedic study, so that those practitioners at each appropriate level can become well equipped, confident, and then serve the communities with a lot of passion and commitment and confidence. That's the basic part we always talk about. But as you will see, the whole Ayurvedic study, even in 6 year of full-time university study, we not able to cover or become competent in each area. And then student have to go for further study, what we call as MD, MS qualification, which is minimum 3 to 4 years of further university studies. And as I always have shared, Ayurveda is not something in a new age science that you go for 2 weeks course or 4 weeks course or 6 months courses and then you become confident. Ayurveda is a very precise, systematic study, an in-depth study. As we have in our medical system, students have to become a doctor with the MBBS qualification in different countries, and in Australia also this is a qualification which students have to acquire to become a normal medical doctor, but then they go further specializations, and those specializations relate with whatever field they are going to, whether they are going with the surgery, whether they are going with the general medicine, ENT, orthopedics, or even gynecology, which relate with the women's issues. And then the obstetrics part is also there. Same way is in Ayurveda. But because in Australia we have 2 qualifications which we teach at the moment, um, one is the diploma level qualification, which at AIS we teach with minimum 18 months of study, excluding all your holidays and other. And then we have a advanced diploma qualification, which is another 18 months of um, study to become a diploma and advanced diploma holders qualification at an appropriate level as an Ayurvedic lifestyle consultant or Ayurvedic practitioner. But still, there are various components which require more precise and more specialization focus on those areas. That is where this course we are talking about, the Daima Ayurvedic Holistic Daima Certified Course, which AIS is offering. And this course can be done by anyone as long as they have a good understanding of Ayurveda, Ayurvedic physiology and anatomy component, understanding on Ayurvedic herbology, and as you have all seen, those who are graduate from AIS in these both qualification in Australia, that we still talk about women's health and women's well-being and children's health. But this being such a big branch, we don't cover all the component which is exclusively for women's well-being at different level. And that's why we have identified that student must have that sort of level of knowledge, understanding, so they can help every woman in this journey of conception and then the delivery and then postnatal care. Because what you all must agree and must have seen, that there are a lot of health problems at each level, physical, mental, emotional levels are coming up with the mother and then the newborn child also. And those imbalances are leading to major serious ailment. And again, no one talk about what is the core cause of those problems. Hence, this course precisely talk about those issues so that even when a couple is planning to conceive or go for conception, they can understand, they can know that conception is never by chance. Conception, why in Ayurveda we always say, has to be planned. And once those couples will start knowing that there is a service which can help them, which can guide them, that how they have to look at themselves, just apart from knowing that yes, I have ovulation, I'm getting every month my egg, and then the male is thinking of the that I have a sufficient sperm and we can go for conception. In Ayurvedic concept, that is not what is required. There is a much more consideration, which known as Garbh Sanskara. So that's what we call as holistic conception. We go with that more and more in detail, and then the reason and logic behind that, so that those couple who would like to get that sort of guidance can be given very specific plan, which will be minimum 3 months plan anyway. But if someone able to understand, then they can look at themselves, that are they physically, mentally, emotionally stable state and want to, means ready for the conception. That program can go even up to 6 months prior to conception. And in that, diet, lifestyle, mental aspect, and then various physical Ayurvedic bodywork treatments are very precise. So that's one part will be taught in this Daima course, what will be starting soon. And then the second part of that, say for example, couple miss this opportunity, they were not aware or they have not come to you before conception, but now they have come when woman is already pregnant. And that's the second part of a program in Daima will be covered, that every month when the woman is pregnant, what lifestyle, what diet, what activity need to be followed, and how her mental, emotional state can be taken care of, so that nothing impact. And this is where Ayurveda talk about that we don't even consider that the little one who this expected mother is carrying on her womb can experience all these various components, whether it is touch, whether it is hearing, whether it is listening, talking about. So, all what is happening around mother or going in the mind of mother can impact the little one. And those are very essential component which need to be assessed, and that only this Daima certified practitioner will be able to share with those couple and particularly the mother. And as all of you know that in today's world we are having so many problems with the little ones when they're born, whether you take it from the ADHD, very simple scenario, or you have an autism spectrum problems happening nowadays, and then also looking into these dyslexia and other issues. Why they come, how they come, that all is being discussed in those um, learning when we are teaching Daima course. And then at the same time, learning is of no use if I cannot advise something how to protect, how to prevent those problems, and if the someone is born with the problem, what protocol we have to give. And that's where you will see those all will be covered in this course. And even though, yes, in our Western medicine we also try to talk about, but we all know there is no specific treatment for these problems, and that's why that little one has to suffer. But in Ayurveda, we have a very complete holistic program which we teach to our those students who come for this course. And then at the same time, there are specific body work treatment in the first trimester, what kind of strokes need to be done, what areas need to be covered, what position of the mother need to be on the table when they are there. Then the second trimester have a very precise sort of body work treatment because there can be certain pathologies coming up and how to mitigate those pathologies. That part is well covered. And then the last phase of the third trimester, in which again very specific care has to be given to that mother because that's where the ultimate ojas transformation and transform from mother to the child happen, which prevent all these mental and emotional ailment. So all those components we cover in that Daima certified course. And these courses are again, it's not that something new in Ayurveda, even in India, students have to go who are looking for specialization in that field so that they can become very precise, specific Daima uh, certified practitioner. And the name as it depicts Dai Ma. Ma means mother, and Dai who look after the mother, and that mother who cannot look after herself while she is pregnant and has delivered the baby also. So hence that woman, and that is the reason that there is a very specific period, we call it as 40 days Sutika period after the delivery that woman must follow. Nowadays, as we all know, that woman delivered the baby and next day she is on the beach, or next day she is watching on the Netflix movie for 3 hours. So all these things, what they are, why it should not happen, then comes the most important food wise. Now Many of you might have gone yourself that delivering the baby in the hospital, and then the what first food come to for that mother, breakfast, lunch and dinner. Is that being looked by any one of us? Reason? No one looked at, because no one think of that food can play a role in well-being. And that is the only one science in the world which talk about the diet, that how food can impact those mothers, because that mother is now breastfeeding, and what is going through her milk is all what she is eating, and then also her how her mental and emotional state, that also going in her milk. But these considerations never talked about by our western medicine or in the other kind of um, courses, or because there is nothing different. Even when we are talking about these different sort of um, courses, or there are practitioners who are being considered that they will be looking after such women who just deliver the baby, in their focus is again on the western medicine's concept, and western medicine concept does not cover any of these elements. So that just a name of whatever the name they give is there, but in actual sense, if you are really looking for a specialized person who can support those women after the delivery, during the pregnancy, and before pregnancy, then there is only one science which provide that information precisely and specifically, and that's where the Ayurvedic medicine, and that course is known as holistic Ayurvedic Daima certified course. So that is where the specific part of the course comes up. Now, after the delivery of the baby, there is a very specific Ayurvedic bodywork treatment, which we call in simple language massage. And I try to very clearly avoid using massage term, because massage is considered in such a big terminology everywhere in the world nowadays, which is flip flop kind of half an hour, 1 hour, even in the our these what do you call them, malls. You might have seen people just sitting having at a table and keep asking, keep come coming in 30 minute, 20 minute. People are just lying on the table as a machine, and nothing is looked at. But in Ayurveda, these are not the, even though they still deal with the body, you can still say the touch is happening, but these are very precise treatment. Hence, these are known as your body work treatment. And the same in Ayurveda. And again, you will see only Ayurvedic medicine or science is the one which is going to tell you how to look after that little one. And for them, we also have specific baby massage in the first 20 days, and then the next 20 days, and then ongoing. How you do that massage and what you use for that massage, all is very precise, and you can experience that if you have the babies, and when you will do those ways, you can see how different and what different it make to those little ones. So then comes up the first baby food part also we talk about, because again, if you see nowadays, many women might not be breastfeeding for one reason or the other, or those who are feeding, they have to start giving some solids on the 4 month or 5th month, and those solids you can go to the supermarket, buy the tin organic super or certified organic kind of tin products for those little one. And that's what Ayurveda talk about, that what exactly is in those and why you should not be. So that's all there is a consideration. Everyone understand that, but no one follow. When I say everyone understand, what they understand? Everyone come to you, they will say, we are what we eat. That sentence is very much talked about every practitioner, every individual, but they don't understand that whatever I am eating, have I looked into that what is going to make me that? If you are eating all the time tin food, frozen food, dead food, what you will be? Have you ever given a thought on that? That is what Ayurveda talk about, and that's what precisely we talk about in this course. So that course is actually happening soon. AIS has started advertising for that, and those who are keen, means even AIS graduate, some of them ask that whether we should look at this course. For sure, because you are well qualified as a Ayurvedic practitioner or Ayurvedic lifestyle consultant. But if your interest is woman health and children well-being, and you want to become a certified and specialization with the women and children, then you should definitely look for this course, so that at least you can know all the details what you might not be able to do in that course, because we have to cover so much in our diploma course and advanced diploma, that's certain the specialization and specialization field we can still not cover. So hope some of you who might be keen to look at that field, because this field is becoming very very now important, and in every area, whether even we talk about the Western medicine or the other, they are understanding the importance of women's well-being. So you can look into that. So I thought I will share with you that what this course is, what sort of things we will be covering there, so that you can look at and make an informed decision. Thanks everyone.